Okay. Up next, we have Dr. Hance Clarke, an anesthesiologist at UHN and clinician investigator at Krembil Brain Institute. In the clinic and the lab, Dr. Clarke focuses on chronic pain following surgery. He's also medical director of the Pain Research Unit at Toronto General Hospital. Okay, he's a day one Raptors fan and season ticket holder, and he also loves reggae music. Okay, Hance, come on up.
All right, good evening, everyone. I want you to take a look at these two people on that screen there. But before we talk about them, I'm here to talk about some of the most exciting work that we have at UHN's Transitional Pain Clinic. It's life-changing and it's groundbreaking, but it all starts here. And so it's clear these people need our help. How'd they get here? Did they have a car accident? Did they have a cancer diagnosis? Have they had surgery? Is there some significant childhood trauma that landed them in this position? And I submit to you, in Canada, we treat these things by prescribing medications. And some of those medications, you add some emotional distress. You look at that life that you thought you would have, but is no longer looking like it's the life you're going to have. And then you think about the connection to these folks that look like you, they look like me, they look like your relatives, our physicians, our firefighters, people who fought for us to protect our country and give us the space that we have. And when you look at that journey and you figure out how we need to impact that and change that, you will realize that this is a complex chronic pain crisis and an opioid crisis all combined into one. And let's think about pain, and let's think about the fact that it's been around for decades. It's been around for centuries. And it's only been 2022 that the World Health Organization declared pain its own disease. So it's time to pause and think about that and give it the attention it deserves. Yes, we are all focused on cardiovascular disease and we're focused on other entities, but chronic pain is the #1 cost to our Canadian society. And it's been 25 years since the Canadian population has had a novel medication brought for the use by our Canadians. And that's longer than the Jays have been made it back to the World Series. So something has to change here, guys. And I submit to you that's not acceptable. And I'm going to tell you how the Transitional Pain Service and my role here as the president of the Canadian Pain Society will start to change the landscape in Canada. And we're doing lots of things, but I'm going to present two to you. And the first is going to be how we're moving down the non-opioid medication road. And we're going to focus on, exercise and our brains and dampening down that pain signal. And that's kind of a core tenet of what we do. And then I'm going to give you an opportunity to go home and pick up your phone and download something you can use tomorrow when you get out of bed. Or give to your friends, because we know that pain is going to be a problem as we age. And so let's start by talking about the cool work we're doing with our colleagues. And I see Dr. Kapoor sitting there in the back row. He's hiding a little bit. But it's his team and our team that have come up with and noticed that THC is an active ingredient in cannabis that may actually have a disease-modifying effect for what Dr. Anthony Pruccio was just talking about, osteoarthritis. And so when we look at this red layer here, and you look at the normal knee that's up there, and the disease knee that's down here, we're seeing that there is some more pink stuff there, the stuff that strengthens your bones. Sorry, I shouldn't turn my back to the audience. That might cost me some points with the judges. And this V that is here is almost pristine. So some modifying effects of this molecule in osteoarthritis. Combine that with the work we're doing coast to coast. We've collected a cohort from Vancouver to Halifax that is now showing us that there is a significant reduction in pain severity and pain interference for the use of cannabinoid-based medicine that will get almost any molecule approved at the FDA or Health Canada level. Now, we get to talk about how that spins into UHN. We just launched the first randomized controlled clinical trial in knee osteoarthritis and cannabis-based medicine last week here at the Toronto Western Hospital. And we are one of the clinical hubs of the Canadian Clinical Cannabis Trial Network. And so that's what's coming in the pipeline, guys. But let me start talking about what you can do now. And we have an opportunity. We've leveraged this with Managing Life. And Managing Life is a company that creates Manage My Pain, And what does this app do? What does this technology do that you can pick up in your hand? One, it allows you to track your pain, report your pain, monitor your pain, and discuss your pain better with your physician. We've created self-management tools and tested this in the urban center versus rural parts of Canada. You can engage up to 30% in the urban centers and 60% in the rural centers, and guess what? It improves your anxiety and it reduces the amount of time you think about your pain. This is the first health informatics data of its kind showing an intervention. And then what I want you to know is that we've now started even the post-surgical setting looking at this tool versus an individual and how it affects their outcomes after surgery. Number one, downloaded app on the Google Play Store and the Apple Store. And just last week, we have launched our AI psychologist online. And get this, by using social media, by leveraging the internet, we enrolled 190 people into a trial in 24 hours. Try to do that with people in clinics. It's a completely different space. So with that, I want to just give, of course, the Krembil Brain Institute a shout out, UHN a shout out, and let you know that we and our service and our team will be changing the landscape of pain in this country and the lives of the 8 million Canadians that continue to suffer every day with chronic pain. And I'm honored to speak to you tonight, and thank you for being here.
Thanks so much, Hance. So you talked about this AI psychologist. Now, as much as I know everybody loves their chat GPT, I think we're also a little bit wary, about the use of AI, and especially when it comes to some kind of health interventions. Tell me how the AI psychologist can work as well, or perhaps in some cases even better than a real human psychologist.
Thanks for the question, Mary. Better than is a far stretch. I think what we're aiming here is to have and some of the feedback that I didn't mention in the talk is that individuals love autonomy. They like to be able to do things asynchronously on their own time, and that's what giving them something in their hand enables, as opposed to that one-on-one care. If it is comparable, we're happy with that, because here's the real problem. 1 in 175,000 Canadians will ever have access to seeing a pain psychologist, will ever have access to multidisciplinary care. And if we can close that gap and provide the most rural Canadians that have a phone in their hand the ability to get care, we have shifted the landscape, not only in Canada, internationally, and globally.
Okay, thanks very much. Hance Clarke.